Good morning, everybody. It's Dr. Pearlman, and I hope the audio comes in clear for this video. Table going down. So here's the deal. I wanted to make a video this morning because one of the most fascinating words that's never really used in pain suffering, like joint suffering, back pain, neck pain related patients, is this word called radiculitis. That's right. We've heard of radicular pain, I hope. And a lot of us have heard of radiculopathy, I know. Many of us have said we have sciatic pain or sciatica when it comes to your lower back and what kind of goes down the butt or in the leg. And then therefore we might look it up or say like I have radiculopathy. Now, radicular pain is defined as a pain in an extremity, but with no loss of sensory or motor function or distribution, if you will, or feeling. And then radiculopathy is the actual, not just feeling or radicular pain, but is also the then accompanied by reduced sensory deficit or a motor deficit, aka if I had right arm radiculopathy of like the C5 nerve root, if I had to resist somebody here, I couldn't do it. It would be like, oh, it would just go down, and then they would grade that a 2, a 3, a 4, whatever. That's for the doctors out there or the practitioners out there. So this word radiculitis is really a fascinating word that should be used a lot more and should be understood and accepted a lot more by people out there, because it's not just radicular pain. It's also the known cause that the nerve root is irritated by a capsule. We'll just say that that's agitated, causing inflammation, right? Itis is inflammation, radiculitis, arthritis, bronchitis. It's inflammation of the part of the inflammation of the part of the anatomy. Excuse me. So when it is compressed, you could have radicular pain or even radiculitis. But what happens if it's not necessarily compressed? What if they can't objectify it on an MRI? If they can't objectify it on an X-ray or something? Well, what's going to happen is they're going to say that maybe there's like cytokines, thanks to the virus. We all know that cytokine is like a cytokine storm of inflammation that is created. Inflammation is a good thing to go to the site of pain or trauma in the body. But oftentimes inflammation can be really annoying when it's giving your body the signal that something is wrong and that there's a lot of pain and issues at the site. So radiculitis is something that needs to be accepted, whereas the nerve root is irritated in the capsule of the joint when it comes to this, back and neck pain and arm pain, that radiates along the path of the nerve root, or the path that the nerve travels, if you will, and distributes throughout the skin. Now, this is important because I don't want people to continue to seek like the one reason, the one thing, the diagnosis, because having radiculitis could be like a whole, subset of diagnoses, if you will. Like you could say that you have carpal tunnel, but really it's it's wrist pain because of radiculopathy causing like a sensation or a motor deficit in the wrist along with just pain. And maybe you can't go through full ranges of motion without pain. Maybe it wakes you up at night because of sharp stabbing, or maybe there's just numbness and tingling. It could be something that's also thought of when it comes to like people that are pre-diabetic or diabetic, or even have fluctuations of high glucose in terms of what then they would call neuropathy or neuropathy-like symptoms. Again, we're not calling neuropathy and radiculopathy the same thing. We're saying that a subset of diagnoses could happen because of radiculitis, right? Nerve irritation, nerve inflammation. And so what I wanted to do was just highlight this beautiful word, radiculitis, in the medical literature and how it pertains possibly to you and the symptoms you're having. Now, because I'm about to get out of here and I'm actually going to be taking the rest of the week off this week for continued education and business trip, I just want to point out, like, what can you do if you have radiculitis? The obvious answer should be to anyone watching, well, you have a lot of decisions to make. Do you use chiropractic, acupuncture, physical therapy, ice, rest, heat, sauna? Do you try to exercise? What kind of exercise do you do? And my answer is always going to be get a proper evaluation. Because if you don't know what the imaging looks like, and you don't know what the physical exam looks like, and you don't know what the consequences are of your ranges of motion, is it going to A, make it worse? Is it going to B, make it better with motion or with exercise? Is it A, going to make it better with rest? Is it going to be, worse with like prolonged rest in a certain position? So those are very important. Get a proper evaluation, consult with somebody that knows what they're talking about, find somebody that resonates with you, because it really just depends. The treatment really depends on the diagnoses, and also depends on what is your tolerance to what your intervention would be. Sorry I was a little spotty today in some of my words. I'm actually super excited and my brain's going a million miles an hour because we got a packed schedule. Things have been very busy here at Paramount Chiropractic and Wellness. And another thing that I'm trying to do also is, people might know this already, is get the functional medicine side of the clinic off the ground, with a great collaboration and participation of my wife, Jen, the nurse practitioner, when it comes to her specialty, which is hormone health. Very well read in functional medicine, and now starting to incorporate a little bit, thinking about how peptides may be beneficial. Of course, that comes with a disclaimer. Please, a lot of peptides that are not FDA approved are only for, if not even animal use, but for human use, in which case they're experimental only. Really consult with someone who knows what they're talking about before embarking on a journey and doing injections. When I say injections, we're talking about subcutaneous peptide use. Whether it's for weight loss, anti-aging, which I think is a misnomer. I wouldn't call anything anti-aging, but when it comes to doing things that are elective and preventative and, so to speak, homeopathic, or any which way you want to label it, please, guys, do your research. Do not watch one YouTube video and think you are an expert. Do not watch 2 YouTube videos and think you are an expert. It takes months of education just to be well informed, and it probably takes years of education and practice through trial and error and understanding, dose response in the way that like a lot of these other medicines are utilized. So, I didn't become a chiropractor and then leave school and know how to, manage the most chronic debilitating lower backs. It took me, a couple of years in practice to not just be really secure and confident in my adjusting before learning to manage conditions long-term with other modalities and co-manage with other people and figure certain things out just on that realm. So again, radiculitis, that's the topic. That's the big, beautiful word. I hope that this helped a lot of people out there. You can always share, subscribe, like, comment, the whole 9, and we'll be here for you. Thank you.